Now, the expanding program on immunization of the Ministry of Health will on Monday, 8th of March, start a nation vaccination campaign against cervical cancer. More than 95% of cervical cancer cases globally is due to infections with human papillomavirus. Daisy tells us more in this report.
The Gambia has introduced a vaccine to fight cervical cancer known as papillomavirus among girls and women. Cervical cancer is the most common cancer among Gambian women, and most women diagnosed with cancer report late to hospital, which have increased mortality. The expanding program on immunization of the Gambia's Ministry of Health is raising awareness on its upcoming nationwide cervical cancer vaccination campaign in the country. Speaking at a press conference on Wednesday, the program manager of the expanding program on immunization, Siddharth Fofana, encourages the public to take the vaccination, especially young girls who are not exposed to sexual activities.
To protect our population is by vaccination. Whatever type of vaccination, and we should come and embrace it. So this little information we are going to give you, use it, try to convince the population. There are people, whatever we do, they're just negative. If people are negative to their creator, who are we? They must be negative to us. So, but if we put down the positive things, the wise ones will definitely come up to take up the vaccine, and they will ask questions, and they will act positively. That way, we will be able to protect.
The human papillomavirus vaccine is said to be 95% effective against cervical cancer. Bakari Tijan of the World Health Organization described the vaccination program as a good opportunity for the Gambia to fight against cervical cancer.
This is in accordance with the WHO mandate to support guidance of country member states to ensure that basic issues are addressed, basic problems are addressed, basic solutions are addressed with regards to hepatitis. We develop strategies called primary, secondary, and tertiary strategies. One of the primary strategies is health promotion to ensure that people are aware of the risks involved. And secondary, tertiary is screening and providing screening services and prevention of the cervical cancer before it reaches the other level. The third level is the tertiary level, which is very expensive, and most of us, particularly in poor countries, cannot afford, which is radiotherapy through radiologists and through radio screening, which is very expensive, and in most cases we don't even have it in most countries. Even if you have it, you don't have experts to run it. So it is an issue. So therefore, this is a very good opportunity for us. WHO has done a lot of reviews regarding cervical cancer issues. So to tell the public very clearly that this is very safe, it has no problem, it has no effect. There is no drug without side effects.
There are misconceptions with regards to the cervical cancer vaccination program and that of COVID-19 vaccinations, but the Deputy Director of Health Promotion, Sanjali Trawale, clarifies that the vaccinations that should take place in schools are for cervical cancer and not COVID-19.
There are so many rumors. People are saying COVID vaccine has already arrived and they want to introduce the vaccine into the school. That is not the case. COVID-19 came in yesterday, but this one has been ongoing since, as I said, since 2014. So it's not the same vaccine. And even for COVID vaccine, we are saying it's very safe and effective, and people should be ready to take in the vaccine.
Cervical cancer is a preventable disease, and it affects too many women in the African region. There is an urgent need to integrate cancer control programs into existing primary sexual and reproductive health care services, strengthen multi-sectoral collaboration, and improve public health awareness in order to tackle this devastating disease. The vaccine has been rolled out nationally since 2019, targeting girls in grade 3, and dropouts aged 9 to 14 are also encouraged to visit schools for vaccination starting 8th of March 2021. Reporting for iAfrica News, I am Daisy.
The Gambia is set to commence cervical cancer vaccination across the country.